significant disparities in access to healthcare services with undeserved communities, particularly in the rural areas and informal settlements, experiencing limited access to quality healthcare facilities, healthcare professionals, and also essential medicines. And when we do refer to the high disease burden, non-communicable diseases like diabetes, hypertension, and cardiovascular disease are on the rise, posing significant challenges on the healthcare system. And healthcare infrastructure challenges, inadequate healthcare facilities, equipment, and medical supplies persist in many regions. And this leads to overcrowding, long waiting times, and suboptimal healthcare delivery, worsening health outcomes for many South Africans. And the health workforce shortages. South Africa faces a shortage of healthcare professionals, including doctors, nurses, and health workers. And the insufficient workforce strains the healthcare system, leading to overburdened facilities, compromised patient care, and also challenging in meeting the healthcare needs for the population. And mental health crisis. So when we refer to the mental health crisis, mental health issues including depression, anxiety, and substance abuse are prevalent in South Africa, yet mental health services remain inadequate. Stigma surrounding mental illness coupled with limited access to mental health care facilities and trained professionals and worsens the crisis. Maternal and healthcare concerns. Maternal mortality rates remain high, with many women facing barriers and accessing quality maternal healthcare services, including antenatal care and skilled birth attendance. So healthcare financing and resources allocation, ensuring sufficient funding for healthcare, addressing inefficiencies in resources allocations, and combating corruption in the healthcare sector are key concerns for improving healthcare deliveries and outcomes. So good afternoon, goeiemiddag Mulweni, and welcome back to the last election debate edition of Sakisi's Webel in the Nation Coordinatie, as we focus on the upcoming elections, where so many is in the sphere leading up until election day, which is next week, Wednesday, May. And I am your host, Jasmine Roberts. And for the next 2 hours, we will tackle issues affecting you and me, specifically health. So you are welcome to get in touch with us should you have any questions regarding today's topic. Our WhatsApp line is 061-862-1065, and you can also send an SMS on 32158. And we are also live streaming the event, so you can watch and interact with us on various platforms, Facebook, X, and YouTube. And all you need to do is search Bush Radio 89.5 FM. South Africa's health sector has transformed in the last 30 years, but there are still significant challenges in accessing fundamental health care. South Africa continues to face significant disparities in access to healthcare services. The undeserved communities, particularly in rural areas and informal settlements, experiencing limited access to quality healthcare facilities, healthcare professionals, essential medicines, and the healthcare sector is also struggling with outdated infrastructure and insufficient funding. And 3 decades later, how is South Africa's healthcare system coping? So today we have various political parties here, so I'm going to give them the opportunity to introduce themselves and to tell us where they, to basically introduce themselves in 2 minutes, and also tell us their plans regarding the health sector. So I'll start with ANC.
Yeah, it's good that you start with the ANC as the ruling party. Yeah, good afternoon.
Just remember it's in 2 minutes.
Oh, good afternoon, everyone, and thanks for having the ANC. My name is Eric Koleta. I'm representing the ANC. Look, for us, healthcare has always been a pillar over the past 30 years. It's the ANC that took over in 1994 and built all the health infrastructure, rolled out primary health care programs, ensured that there's access to health care in rural, informal settlements, and also the fact that health cannot be accessed on the basis of privilege or cost. So that is in a nutshell that we've standing for the ANC.
Okay, so I'm going to give it over to the ACC.
Thank you so much. As the ACC, we are observing, painfully so, the deterioration of the public health care system in this country. And it is in shambles. And as the ACC, we are equal to the task. We, for the very first time, experiencing the unemployment of doctors. There are not less than 1,000 doctors that are unemployed in the country. Shortage, but there are shortage of doctors in hospitals, shortage of nurses in hospitals, and as ACC, we are going to make sure that there is more doctors, there is more nurses and all the relevant health professionals, and we are going to build infrastructure, because it seems that the current ruling elite could not even get the basics right, because those are the basics, and healthcare is a fundamental. On that one, it is fundamental. Thank you so much.
Thank you very much. Your name?
My name is Ngose Kayalala. I'm the Secretary General of the ACC.
Thank you. So, ACDP, DA?
I'm Norma French Mbombo, representing the DA. Indeed, the South African health system needs a complete overhaul. Both the public and the private, they are not in one space. So it is crucial that there are urgent interventions. And one solution is universal health coverage. Whilst the Western Cape is managing the infant health system perfectly, we are not where we should be. Until the private health is sorted, until the public health is sorted. With our health coverage, what we're doing now, we're also helping at the national level to ensure that it gets implemented. For the private sector, how we ensure that people, the medical schemes are affordable and also private health is affordable so that there is no medical dumping in the public space. In the public space, how to ensure we provide services that leave no one behind, because currently we find that those who are in the metro, in the Western Cape, for example, versus those who are not in the metro, they're not necessarily getting the better health services. So quality health services that are affordable, that reaches and cover everyone, it is crucial. So we continue doing what we're doing, but also helping the whole country whilst we are in government in the Western Cape.
Thank you. And then we have EFF, Good Party.
Hi, good day. I'm Joy Davids. I'm representing the Good Party. Good believes in and promotes services for everybody, equal services to everybody. We do recognize that we have a constitutional responsibility, especially towards South Africans when it comes to healthcare services, and this is not currently happening. So we do accept and we do promote that government can do more, whether it is national, provincial, or even local government. There is a need for basic health, quality health, and we are not getting that, especially on the ground. And we've seen and we've experienced it ourselves, but we will speak more about that. Thank you.
Thank you very much.
My name is Dan Verhoeven. I'm from the People's Movement for Change, and I'm going to focus on the principles of the PMC, which is God first, family, and community. And we need to have a health system that focuses on all these three principles to create opportunities. We cannot ignore the historical injustices that happened from Jan van Riebeeck's time and up to now, because these were all that caused disparities in health and inequities. And as much as the private health sector is now going haywire over the new NHI, one need to understand that the private health sector contributed much to the expenses that the public health sector is experiencing. they caused health to become a commodity, which now cause the public health sector to keep up with the expenses or the cost increases in private health. Now they're up in arms about the NHI. Currently the NHI is a guideline for us where we need to develop regulations to indicate how things should be done. And if you look at who is focusing on the NHI and challenging it, it's the rich people, the people that have money, the people that are going to lose money. So we need, from our side, we are saying we need to eradicate disparities, ensure equitable and just service to everybody, and focus on the family and community, and let the community participate in decision making.
Thank you very much. Rise Mzansi.
Thank you. Good afternoon, and good afternoon to your listeners. My name is Akoli Mtwala from Rise Mzansi. Rise Mzansi, we believe firstly that some of the challenges that contribute to healthcare and healthcare sector are challenges that come outside of the healthcare sector, which continue to overburden the healthcare sector. When you have the highest rate of violent crime, that overburdens the healthcare sector. When you have the highest rate of preventable diseases, that overburden the healthcare sector. That means we cannot just look at the healthcare sector alone. We have to look at making sure that we provide people with water and sanitation services that are dignified, so that they do not get sick, so that their children don't get sick from diarrhea, with overburdened the sector. The second thing is that the healthcare sector is also understaffed, and corruption also contributes to the services and the funds that are meant to help many South Africans. And those are things that we say as Rise Mzansi we must deal with. We need to make sure that there's proper management. You have so many healthcare professionals that are moving away from the public sector to the private sector. It weakens the public sector. We need to make sure and call even on politicians and those that are in government and those that are leading to make sure that they resource the public sector so that they can also be using the public sector instead of running to the private sector. So those are some of the things that Rise Mzansi wants to prioritize in making sure that we all can have quality and affordable healthcare.
Thank you very much. And I didn't get the last party's name. Excuse me? Okay. So please be advised that Bush Radio has sent an invite to all political parties contesting the upcoming elections, and we would like to thank everyone that is here today. So the first question is, South Africa faces significant challenges with access to healthcare in undeserved communities. How will your party address these disparities and ensure fair access to quality healthcare services across all areas of the city? So I'll start with PMC.
Yeah, the future of healthcare lies in a focus on primary healthcare. And the focus on primary healthcare isn't necessarily facility-based, meaning that we shouldn't depend on government. It should start at the family. If one consider, in the past, when I was younger, my mother was the person that cared for us. They knew what to use for smallpox, for everything. We didn't go to doctors and stuff. That kind of knowledge needs to go back to the community so we can start there and alleviate the pain of the national or provincial systems. We need to focus on prevention, on a proper universal health care and a national health insurance. It should be less hospice-centric, and we focus on decreasing factors as external to health, like transport and environmental health, transport factors that cause injury. We need to redesign and co-design the health system with communities and families to balance societal and cultural needs and ecological exploitation and re-engineering. Economics should be second to ecology and social cultural elements. Because once we focus too much on economics, then the social, ecological, cultural elements will take a backseat and will impact negatively on the health landscape.
Thank you very much. ANC.
Yeah, thanks once more. I think first I must make the point that the unfortunate part in this election is that you've got a stockpile of political parties that were recently established and weaponized against the ruling party, which is the ANC. So their aim is nothing else that they present for South Africa other than removing the ANC. So I just needed to make that point. Now, healthcare remains a very important pillar within the broader vision of the ANC. If you can look broadly at the budget, it ranks in the top 5 after education, welfare, and of course, social development. Now, the overall budget of healthcare, if you can distinguish it, it takes about just 6.3% of the total GDP. Now, that particular budget is then split between these two-tier system of private and public, which the private gets a fraction more than the public health, which then the same private services 16% of privileged South Africans with medical aid, whilst the latter, which is the public service system, which services 84%, has got a lesser budget, which then means if someone unemployed from Manenberg perhaps wants to go and give birth to the public health system, which the ANC has enabled that the system should not exclude that particular individual on the basis of finance. They will go into the system and come back with a newly born, beautiful baby. But if you go to the private system, you will not pay anything less than 70 to 74,000 rand. Hence, the
Thank
ANC.
you very much, ANC. I'm going to give it over to the DA if you want to respond to what the ANC also stated.
The future of healthcare in the country, again, it needs universal health coverage, what we've seen in countries like Thailand, countries like Brazil, but in South Africa, understandable, the context is different. What does it mean? It means that you need to cover the population across. You have to cover the various essential services. And the third one, which is what now the NHI is saying is trying to fix, is there to cover the issue of the affordability, the financing. At the national level, the health sector, whilst the ANC is talking about health is one of those out of 5 that are in terms of the budget allocation from the GDP, noting the health sector has been decreasing in terms of the financing. There's no increase, except during the time during the COVID, whereas the other sectors have been given more. And then within the health sector, I did indicate the issues of having these two-tier systems, the private and the public, it doesn't benefit anyone, because especially the high unemployment, those people who used to have medical aids, some of them they don't afford. Even if you do have medical aids, they are being charged more, or even within that you have a medical aid you can be able to afford. Some of those, they still come to the public sector, like in the non-metro, where we find that there are no private hospitals like universities and all of them, they still come to us. That's what is required. And to strengthen the system, you need health financing system to be strengthened, the human resource system to be strengthened, the health information system to be strengthened, leadership and governance. Then you talk about what packages of care that you need to provide when we have strengthened all other systems. That's what we're saying.
Thank you very much. ICC.
Thank you very much. Maybe let me start by saying, we observe that most of the time the health sector or public health, I want to put a finger on public health, is affected by things that are not necessarily supposed to be public health issues, the issues of corruption. So there are certain things that we need to be addressing as a country. Corruption, the administration and management capacity. Even when we talk NHI, this very NHI will be grossly affected by the administrative and management capacity of the state. It will be affected by corruption. If you look at every institution that is managed by the state, you find that it's affected by those. So we need to address those key things. But looking into health directly, we need to get basics right. We have, just yesterday I was reading in one media outlet, a woman complaining in Delft about the fact that her mother was sent to a public facility because she had an issue with her leg. And she stayed there for 3 days without seeing a doctor, and was sent back. And again went back without seeing a doctor, and to a point where the leg has deteriorated. Those are the things that we need to be dealing with. And as I said, as ACC, we need to deal with the fundamentals, get the staff in the health centers, and we need to have health centers very close to communities within 5-kilometer radius. We need to do that. We need to eradicate the bucket system.
Thank you very much, ICC.
Because there are all sorts of things that are affecting us.
Rais Mzansi.
Thank you very much. The issue of infrastructure is important, and the issue of making sure that we have enough and well-equipped healthcare facilities. Rise Mzansi will make sure that there is a basic healthcare facilities and wellness facility within every 15-minute ride of every home, and a major health facility within an hour. We'll expand the training of additional healthcare workers to make sure that we keep up with the population, particularly in urbanizing places. We need to make sure that we employ more healthcare workers that can also be able to take care of the elderly, people living with disabilities within their own homes, those that will struggle to travel. And this is why we continue to condemn the taking away of money from health that is taken to the safety plan in the Western Cape to law enforcement. It means that we must have a conversation about drug and drug abuse, because it is a health issue and it is a social issue. That means the issue of mental health and substance abuse is something that we must all take care of as a health issue and not as a criminal issue, because we are criminalizing people that are victims of substance abuse. I just want to end by saying that the reason there are small parties that have come up is because the political establishment, the ANC and the DA, has failed. Parties do not just crop up because people are restless and don't have anything to do. We realize our country, these two parties are taking our country to a place that many of us and many of our parents didn't imagine from 1994.
Thank you very much. Good morning.
Thank you. I think we have to approach healthcare in South Africa with a two-pronged approach: preventative measures and curative measures. So I did environmental health many years ago, and we were taught, this was more than 20 years ago, we were taught about preventative measures, but I've never seen those measures being implemented at grassroots level. Although you had your community development, you had to go out to the communities, you had to do training, education, etc. I think we fail our people on the ground, because if you teach people how to take care of themselves, personal hygiene, then we will have less illnesses. So now we're at a curative side where the hospitals they can't cope with the number of patients that they see. The clinics can't cope with the number of patients they see. So if we focus on both aspects equally, I think we could have a better healthcare services for the entire country. And then also, we need proper infrastructure. I'm based in Atlantis. Atlantis has a temporary, it was a temporary clinic. It was built in 1976. It's still the same facility with a little bit of upgrades. It serves as a clinic and a hospital, a district hospital, and the population has increased tremendously. So we have this bottleneck effect at this hospital. People are waiting in long queues, people get frustrated, and the hospital has to see to all sorts of patients. Yes, we have the clinics now transferred to province, which should have alleviated a little bit, but it's still the same. I've been to the hospital myself. I can't afford private healthcare. So I sit in those queues. I have to wait my turn, you know. But what are the people the pensioners, for instance, people with disability? So how are we treating our people on the ground? We need to treat our people with dignity. There's also examples where people come back the next day because they haven't been.
Thank you very much. We're gonna stick with, we're very strict on the time, so we remain in that 2 minutes. So as you basically touched on the NHI, so President Cyril Ramaphosa last week signed the National Health Insurance Bill into law, and the NHI is seen as a potential solution to many of the obstacles that patients are currently facing and addressing when it comes to inequality within the sector. And also taking this in account that it took 12 years before the bill was signed. So on that, what is your party's view on this, and do you think the NHI will be the solution to curb the problem we are seeing in our healthcare facilities? And also the WhatsApp, 14% of the population have private medical care, the remaining 86% of the population afford to pay the medical aid and rely on the state clinics and hospitals. So how will NHI be paid for, and why was this bill only approved days before the election? So I'll start with ANC.
Yeah, as earlier mentioned, that all the infrastructure in the current health system was built by the ANC. 30 years later, in actual fact, NHI was not only born before election. Let's just verify that. For the past 10 years, my colleague next to me, when we used to be in Dinosa and how we've been championing this bill for years. Because this is the actual bill that will ensure that you don't distinguish between access to health care on the basis of affordability. Now, it will be funded through our taxes, and it will ensure that you are not chased away from accessing a service on the basis of I have money and no. Now, the understanding is totally incorrect. Now, as the ANC, we must be able to make people understand. It does not mean tomorrow all of us will just go and walk into a private hospital. Currently, the private healthcare system, which is characterized by massive corruption, by the way, it loots healthcare staff that has got medical aid. If you've got the medical aid, by May, they will tell you your medical aid is maxed. If you've got a procedure that needs funds, they will not, you'd rather die. So NHI is here to say we're moving away from what private health call prescribed medical benefits. They will count and say you've got only this for your medical aid to afford. Post that, you must pay out of pocket or co-payments. But the NHI says we pull all this together, and then you will not be needing a medical aid. You must go to your nearest GP, you must go to your nearest healthcare facility, and your treatment should not be based on whether I can afford, whether I cannot, because the government will have paid for that so that everyone can access free, quality, and decent healthcare.
Thank you very much. DA, in a statement it was stated that DA disagrees with this bill.
Indeed. NHI is insurance. It doesn't say anything about how services will be packaged. Meaning it talks about the monies. Currently, what the Act says, it says that the provinces will cease to provide the health services except for those that are within the constitution, which is mostly the EMS. And then it also says it's going to pull more taxes in order to fund such. As I indicated earlier, the South African system needs overhaul, both for public and private. But you cannot take money through the taxes for the people already paying large amounts, because majority of people are unemployed, and say they must finance that. We could be able to implement universal health coverage in the current status quo, and then progressively and fix other things. For example, once the president has signed, nothing's going to happen until about 10 or 12 laws that need to be repealed or amended. So one of the other things that will impact on the province is about the provincial equitable share, money that's supposed to come to us, the conditional grants, now they'll go into the main fund. And also they'll be buying these packages of care from Pretoria for the people in Central Karoo, because it will be managed by the district management team that they will appoint there. And also remember, for WHO, it says that the supply chain procurement must happen at the local level. It shouldn't be done elsewhere. So it's one of those things that says it's not affordable, and also it is unconstitutional, because health is a concurrent function of the province and the national, as according to constitution.
Thank you very much. Rising Zanzi.
Thank you very much. So we do believe that the signing of the NHI is an electioneering tool from the ANC. Over this past month, there's been no load shedding. We've seen the opening of police station in Makaza that should have been opened 20 years ago by the ANC. The trains are now going into sightseeing, and this is all things that are happening before the elections. So the ANC is playing with people's lives. These are things that the ANC could have done if we had the right leaders. Guys in Mzansi, we are saying we believe in universal health coverage, not the current form of the NHI, because it doesn't resolve the many issues that we've already spoken about. It doesn't resolve the many issues of public infrastructure. It doesn't resolve the many issues of access to healthcare facilities. Just because you have the NHI, it doesn't mean that many people, particularly in the rural areas, are going to be able to afford one, are going to be able to access those healthcare facilities, because they're still very far from them. People have to travel hours to get to healthcare facilities. Even if they are private healthcare facilities that they can be able to access, we know because of our spatial legacy of apartheid and the way in which services are situated, many people are still not going to be able to access these facilities. And so we are saying deal with those basic issues first before you deal with the issues that the ANC talks about.
Thank you very much. Good party.
Okay, so Good Party supports the bill. We recognize that we've a multi-tier healthcare service. So you had your public or your private healthcare. But we've also experienced a situation where the majority that can afford private, they would get the best treatment, the best facilities, the best doctors, etc. And then you would have an instance where people would die because they can't or they don't have access to public health even. So what do you do? What is the right thing to do? Yeah, we are aware about the current state of affairs.
The pen that you...
Oh, sorry. Yeah, we are aware about the current state of affairs, and so we need to do what is right at this stage. So what is right is for everybody to have equal health, no matter what it takes. So we need to engage, we need to look at the concerns. Yes, all health professionals do have their concerns. Some parties will have their concerns, but we need to sit around the table and engage and make sure that before this is implemented, that we have ironed out what we need to iron out. Everybody needs equal health care. Thank you.
Thank you very much. ICC.
Thank you very much. One of our challenges as ACC is the timing of this bill that has been signed into law. Yes, one would say it has long been coming, but it is not coincidence that it is being signed now, when we are a few days before elections. And we detest anything as ACC that plays with people's lives. Coming to the nitty-gritty of it, we as ACC we are saying the lack of governance and accountability and corruption has led to several of public facilities to these current levels of deterioration. Now, we worry with this NHI that it will not improve anything if still within the management of the very same people. The other thing is that there is no costing. I haven't seen the costing that says that this is what will cost the state, this is what will cost the fiscus. There is nothing of that sort, so that there is no implementation, nothing. It's just a dangling of something that people should look at, but still it will not lead to access. The women are still going to give birth to pavements, are still going to give birth in the streets and in the taxis, because that is the order of the day. This NHI bill that has been signed into law is not going to change any of that sort within the short term. We just need to be dealing with these basics that I've been talking about and making sure that the ACC, when it is in power, will be able to deal with that. And I said we're equal to that task. But this NHI is just a dangling of the carrot and it's playing with people's lives. Thank you.
Thank you very much. PMC.
Yes, from the PMC side, we support because that supports the philosophy and principles of the UHC. However, we would like to call on people to stop fear mongering amongst people, because creating fear amongst people of this NHI create further pandemonium amongst the communities. This thing has been coming on for years. Wait for perfection, it will never be implemented. So we believe we need to support it, but at the same time, if we have a management company that manages the NHI, it should be a reputable and capable organization who does not have corrupt officials. And since Gupta Gate, there were a lot of them, and I hope all of them has been eliminated by the ANC. I understand they were pushed out, and I want to make sure they are pushed further away from anybody. Furthermore, about the functions in terms of the constitution should stay as it is, with provincial health having its own particular responsibility and national. The problem with centralizing services, and if I look at the health system when COVID-19, when we did the information system on COVID-19, we struggled to rectify systemic errors or systems errors, because it can't be rectified on a lower level, it needs to go to a national level. And the problem is we're going to sit with the same issue where if we have challenges on a provincial or local level, then national is going to take long to rectify this stuff. We need to bring services near to the community and let the community be involved with it and solve it as quick as possible.
Thank you very much. ANC, would you like to respond to Rise Mzansi, DA and ACC?
Yes, I have to, because there are some distortions, but I will also first with Rising Mzansi, they are still a newborn. The remarks they make regarding the police station in Makaza, it's not only yesterday. If you could look back, Kailicha Commission on Crime, that was years ago. That did not even exist. And that police station did not come via a balloon. There was a police station when the National Minister of Police, the Deputy Minister was still Bongani Mkomi. There was a police station actually directed by the government of the DA to be built for 100 million in Muizenberg. with the intervention of the progressive structures of Khayelitsha, including the ANC, we've engaged them to allocate that particular police station. So now you will understand the bureaucracy, it takes time, but since now we've started with the temporary and it's the launch now of the police station. So I just needed to give rise to that. Corruption, look, as the ANC, we are not naive, we understand there is corruption, it's a systemic issue. But it's only us that stood up and said we're subjecting ourselves to public scrutiny and put in place what we call a Zondo Commission. And all of you have seen how amongst our own within the ANC have been arrested and sent to prison. We know the corruption in the TA, in the province. No one done anything about that, including the rising science and not saying anything. So like I are saying, we understand these issues. I agree with my colleague, that's not fear-mongering. It's long ago that the ANC has built institutions that have got serious credibility. When we started, there was no SASA. In 1994, 30 years later, it's a well-oiled machine, including this NHI. We understand it. We did not just come out of a lucky packet. We are going to ensure that we receive equitable health, regardless of the fact that you can afford or not.
Thank you very much. DA, I'll give you time to respond to that, and then
Still on NHI, remember the first pilot was 2012 to 2017, where each and every province they selected one district. In the Western Cape, they selected what we call now Garden Road, it was Eden. In other provinces, the provinces added other, like in the Eastern Cape, the other 2 districts, in the KZN 2 districts. What were they piloting? It was in 10 areas. Without mentioning all of them, one of them is a school health, the ideal clinic, the ward-based community health workers, and so forth. They did evaluation in 2018, 2019, where they found that actually it was dismal. So now, what they are saying for this NHI Act is that they will pilot it now until 2026 for maternal and child. Why are they not piloting it on the indicators and the targets they set up when we do the first pilot? That's the question. Again, it's the bill or the act is vague. Nobody knows. We are all making an assumption what's going to be. The only thing we know is about the Improve Fund, and the National Health Minister will create this fund, appointing the board who will be managing the fund. The provinces will be able to get their provincial share. They will be able to get their additional grants. On the issue of the medical schemes, they can't do anything until they repeal or amend the Medical Schemes Act. That's why it will only happen probably 2080 or 2050. Thank you.
thank you very much, Rising Zanzibar.
Thank you very much. Sorry to be sidetracking a bit to get into this police issue, but it is late because ambulances can't go to Khayelitsha because of violent crime, because they are attacked and all those issues. So these things are interlinked. A bit of a history lesson from the ANC. The Khayelitsha Commission of Revival was established in 2012. It was opposed by the ANC. It went to the High Court, the ANC lost. It went to the Constitutional Court, the ANC lost. The Commission of Inquiry started its work in 2013. And in 2014, it issued a report, 2014. In that report, it talked about the Makaza police station, which was supposed to have been built in 2004. 10 years earlier, that was in 2014. This is now 2024, so it has taken 20 years to build one police station. And this is because of the pressure of civil society. I was involved in the establishment of the Khayelitsha Commission of Inquiry. It is not an ANC. The ANC was opposed to the Khayelitsha Commission of Inquiry, which means if we hadn't fought, if we hadn't fought the ANC, together with the Khayelitsha Development Forum, Nditini Chibe was opposed. If we hadn't fought them as civil society, we wouldn't have the police station in Makaza. So the ANC must not come here and tell people lies while they have opposed services to the people of Khayelitsha. That is something that we must comes from.
Thank you very much. So we're going to open the lines for some WhatsApps.
Just foster delivery service with patients that is like being shot or bleeding internally.
they need to have like the staff is not there like previously, like previous years. They need to get that back. Like people is just in it for the money.
We have a problem with the securities. They must act like doctors. Those people, why they acting so? They are only security.
You have nothing to say on that. Right, Zanzi?
I think the one point I can respond to is that we live in an unequal society, and so the rich do benefit much better in terms of healthcare facilities. It also depends on where you are and where you stay in terms of your geographic location. And everything that we do must be things that benefit everyone. So it's not only people that have money that must benefit from benefiting from healthcare and healthcare services.
Let me just indicate, I think it was said by Joy earlier, or I can't remember, the issue of the socio-economic, political, and commercial determinants of health, the impact on the health throughout. What we see in our health facilities is not only diseases or health problems, but it's the social factors. I think it was Claudia who mentioned the issue of the interpersonal violence. This is a socio-economic matter that happens there, but it impacts and absorbed by health. When people are poor, when people are unemployed, those people cannot be able to afford health services. Then they queue in the public sector, the health public sector, of which its budget is shrinking. In the Western Cape, for example, last year, 1.5 billion cuts on the budget. So what needs to happen is about health is everybody's business. Social development, economic development, other spheres of government have a role to play so that we don't end up putting a lot of pressure on the staff, on the health services. So I'm just responding on the issue related to the violence. Lastly, the issue of the attitude. Whether you are a security guard, you are a cleaner, you are a professor, you are a whatever, people come to the health services at their most vulnerable moments. Everyone needs to espouse the values of caring, respect, and dignity. That's why we've got the hotline so that we can report that person immediately. But it becomes difficult to do a blanket approach where you say that everyone in Karameja is rude, everyone in Tagaba is racist, because you won't be able to make one person account. So that's why people need to report Sister Mogo. Dr. Mogo is the one who was rude so that we can be able to act on that.
Thank you very much. We're going to break for the institutional news, and then after that, we'll come back. So look at the Buckle Bush Radio 89.5 FM. And do remember the WhatsApp line is 061-862-1065. If there's any questions that you would like to the parties to address regarding health. into Bush Radio 89.5 FM as we are busy with the election debates leading up to election day. If there is any words that you want to direct any of the so what's directed when we need not serve the when we are not served with dignity, but nothing gets resolved when we do, but still wait long hours at clinics and hospitals. Also gets attitudes from staff when making inquiries. So we want to know from you as the Health MEC, what will your party do to rectify this? So DA, can you respond to that?
The people are sick, the people, others are unemployed, so we've got a high level of demand of a service. But the issue is the supply. Supply in regard to that, as you know, that the Western Cape is third populous after the 2022 census. We've got numbers that are increasing. There are people who are flooding the health facilities. And if the staff numbers don't match those people, why is it that? It's because of the budget. It did indicate last year we're 1.5 billion cut short in terms from the provincial equity share for the Western Cape. And also, whilst we talk about, I think we're the second largest for the people who have got medical aid after Gauteng. But note it, in the rural areas, there are no private hospitals. The same people come to us. Actually, even in the metro, the people in Gauteng, in the valley, the older persons, they come to us. Once they can use their medical aid, for example, for the emergencies. So the point is about the supply is more than the, is more than the demand. So how we can be able to ensure, we have to strengthen the system, as I'm saying that there's a hotline. But you get maybe one unit where there's supposed to be 8 staff, but there are 5 members, but there is no justification for being rude, whatever, no matter what. So that's why we rely on the CEO to be able to sit down with some of those, we've got some of the major complaints, to have a conversation with the families and explain. And also that having wellness hubs so that people don't get clogged all in one facility. We do bring services through our partners with the NGOs and the taxi rank and the clubs and everywhere. And then we talk about the issues of wellness in terms of prevention and promotion, so that people don't necessarily that without having a serious illnesses that they have to clog the hospital. And first people to go to is the clinic or community day center, the primary care before, because everyone will want to go to the hospital where you prioritize mostly those that are sick. So the issue is the resources, is the budget.
Thank you very much, DA. And then also, how will you address the persistent challenges of corruption and mismanagement within the health sector? So we'll start with ANC on that.
Yeah, thank you very much. I think I've already raised it that the ANC is the only one that is serious about corruption through establishment of the Zondo Commission. And we have seen the corruption that ensued during the COVID-19 period, particularly with regard to PPE. And again, we have ensured that we even take our own. And it's not something that can only be left to the ANC. All these other organizations, which by the way don't have anything that speaks to corruption in their manifestos, needs to do something. Because remember, at the national government level, the ANC then cascades the resources to provincial level. Then you need to have checks and balances at provincial level. Now, if those things, particularly in the Western Cape, are kept at bay and you only pay with the fingers to the ANC, we are not going to win the war, because corruption steals from the poor. We all must speak with one voice in addressing corruption. And as the renewed ANC, we are very much serious about corruption. And we are going to continue to ensure, hence we are even lobbying our friends here. They must say something on corruption, even if they are own, which is something that we have not seen forthcoming. We are the only party in the world that has ensured it subject a sitting or a former president to the justice system and took it to court. It's unprecedented to show how serious we are with regard to corruption as the ANC.
Thank you very much. PMC.
Yeah, I think there are persistent challenges in terms of corruption in government. And fortunately or unfortunately, the PMC is new, so nobody can blame us of corruption. And I think I'd like to challenge my friend here next door to me about the Zondo Commission and ask
Can you just bring the mic closer?
whether the Zondo Commission's resolutions or recommendations were implemented. But for us as PMC, how we're going to deal with corruption is that we want reputable people to be appointed in these positions that concerns money. And there must be proper governance of that. I must tell you, in the organization where I am, you must first fill in a request for the money to be paid. That request goes with an invoice. That invoice goes to another person. So the same person that does all that stuff isn't the same person that pays the money. And the reason why we sit with a system where people can just do what they want with money is because the same person that writes out the check is the same person that approves the invoice. Thank you.
Thank you very much. ICC.
Thank you very much. As ACC, we believe there is a need to send a very, very strong message when it comes to corruption, because corruption is a disease that is affected every facet of the South African life. That's why I would differ with a colleague from the ANC when saying none of the parties are saying anything about corruption. The ACC has been very clear on corruption. I think it's the only party that says we will need, just like it is the case with rape, that is our position, life sentence when you are found to have been corrupted, if you are a public official. That's a very strong message. Now, when it comes to operational level, we need to put a proper vetting of everybody who's going to be working in the areas of finance. A proper vetting to check the background. How have you been in your throughout your career, when working with the finances of the people? Are you a person that could be trusted? So I think we have as a country, we have slipped on that. That is why we have this disease. It is so abnormal, but the country has accepted this kind of abnormality.
The performance of local government, and if they are unable to do it, they must put processes in place to ensure that the services that must be local government, the community is getting it. Because I think, like the minister said earlier, if you're not providing the service on the adequate level, then it's like Mr. Pistorius that shot his wife in the toilet, which is murder plus eventualis, because if local government is aware that sanitation and sewerage problems are going to cause problems and people die of it, they need to keep those people accountable for their actions. And that's a problem in South Africa. People aren't kept accountable for their actions. That is being normalized.
ICC.
Thank you so much. There is no excuse in this day and age that in this country we still have bucket system. There is just no excuse. As ACC, we stand on the ideology of social justice, which in this regard our choice of development is that of human dignity, redress, justice, fairness. And we believe that to still have such the bucket system is just a crime. The reality of the fact is that whether one can agree or not, it shows whether the government is caring or not. And I stand on the side of those people, that we are living in a space of an uncaring government. There is no government that cares, that can still prolong such a system. As ACC, we say, this is one of the things that should have been eradicated a long time ago. And we'll definitely make sure that we eradicate that system of the big toilets, the bucket system, and every household must have clean running water. It must have access to clean running water. That is our stance as ACC. The current situation is just untenable, and it's a situation that should not have been in this day and age. Thank you.
Thank you very much. ANC.
I think I can't overly emphasize the sentiment by my Leonard friends on the responsibilities and the state of particularly those areas of the working class in the Western Cape. Yet you've got a DA that prides itself that Western Cape is the best run province. That's then where you discover the tale of two cities. You can say that if you are staying in Greenpoint, in Camps Bay, yeah, in your glass mansion, then you can say it's the best run. But if you take a walk, Manenberg, if you go to Kleinvlei, then you actually see, in our language, we say, Sisekaki, that is, people are staying right in front of offices, which is a competence of the city. Now, equally so, remember, for people to have access to sanitation, you need to have a decent housing. Now, it is the same government, the waiting list for houses here in this province spans since the 80s. Yet you've got the DA government and administration that still returns money to build houses to treasure. We must also raise that it's unfortunate our Leonard friends, the EFF, are not here. It was part of what you do, you plan. You don't just encourage people to say, let's go take land and then you go in there, because it's got consequences. Now, that's what happens if you are actually populist. You're just telling people to do things for their own ambitions because they come back. The issue of land, we've long had it in our founding documents of the ANC, that this is how we need to take land, because tomorrow we will face such problems if we just decide to walk over a road to take it. Equally, as it relates to the issue of ESCOM, everyone was complaining that it is an electricity minister. Now there's no load shedding. Again, my Leonard friend of Mzat is complaining. We are going to enjoy its history of load shedding.
DA.
Thank you. Water and sanitation, these are very crucial part of the hygiene. Unfortunately, it is a local government competency. However, it impacts on health. So that's why if there are people are calling and say that we've got blocked canals or there's a problem with sanitation, we jump and ask the Department of Local Government, the province, to assist. Its responsibility includes to work with the municipality on how to assist them to build the bulk infrastructures. Because in some places we find that the community was, population was few, now there are more people, it means that the drainage is always blocked. Like in areas like the Philippines, we'll find that the city has to come now and again, the big trucks and all of those. So that is important. As I indicated earlier, the social determinants of health related to the sanitation with the water, it impacts on us, on health. Yet it's not our competence. So that's why I said health is everybody's business. Because it will, once there is a poor sanitation, we'll end up having diseases like diarrhea, for example, and also other communicable diseases that are impacting around there. So for health, we have to work with everyone, irrespective whether it's a competency or not. So what I know with the city, they've already made a commitment of putting more money of the bulk infrastructure, which is more than John Johannesburg and eThekwini combined to ensure with the number of population that is coming in and with the challenge of having the bulk infrastructure, as I made an example with the Philippines. So they are committing to such. From the provincial government, local government, they will always issue, for example, the green scorpions and issue the directives if there are issues of the waste management and any other parts of it. And they are the first to jump, like what we've seen in the Prince Albert, when there was an issue related to the water shortages.
Thank you very much. We're gonna
Take chance as you were also concerned, because basically South Africa in the health department side, I think it's basically just not on, in my opinion. Like Madiba said, health is free, education free. So at this moment, as I can see it now, that nothing is free. So they're sitting there waiting for hours to be held, especially with children and old people are concerned. That is now where we come in as youngsters, actually, or younger person, I would say. This is not right, this is not on. Why do you treat the old people like that? Why do you treat the children like that? Some people sit in that chairs and they actually die. Everybody knows about the situation there, but they're not going to attend to that person. So I just think that the health is very bad in South Africa, and I think they can do something about it, which they don't. That's one of the promises that they get made, but it's not going to happen. Everybody knows it. They're just in for our votes, and after that, load shedding starts, everything starts after that. So yeah.
Expensive, so maybe like they can tone it down a bit for people who don't have enough money and stuff like that.
There's not enough staff, whether it's nurses, cleaners, porters, doctors, surgeons, whatever you call them, and they should have more facilities available for the people who's explained. There'll be 2, 3, 4 doctors, and there'll be like 4,000 people, and we can sing home, and then you must come back tomorrow, stand in a long queue again with the hope that you will be out.
The one thing I'd want to see change in the health sector is women's health particularly. I truly don't like how women's health is kind of overlooked. Like a woman comes to the public health clinics or whatever, and they don't necessarily get the help that they need.
I want the nurses to change their behavior and us as girls to enter there freely and not just feel embarrassed or ashamed of ourselves because of the nurses.
The people, especially by the government hospitals, because the nurses, they don't have the passion to work with the people. They don't care about the people is coming, is sick. Old people, all of us must sit there for hours, and then they help you, and then you must go to see the doctor or the nurse. People must stand outside by the for in the cold for 3 hours before they get back in to go see the doctor. You go in, you sit another 4 hours. You come there 5 o'clock, you go out there 4 o'clock. Does it make any sense? They don't care about the people. Even all the day hospitals, wherever people go, we sit there for an hour. And I mean, if my father is really sick, what am I supposed to do? Because I must swear at the next person to get help here for the sick child or for the sick father of mine. So that is not the health department. They must pull up their socks.
So that's just some of the WhatsApps that come through. So we are running out of time, so I'm just going to give all the WhatsApps at once. So the Western Cape government is not serious about health services. The MEC made a lot of promises here in Grabouw when we requested more doctors and proper hospital in 2019. And we sent an email address to her reminding her, but she never cared to answer. The only language of communication they basically understand is tire burning on the N2. And then this question is directed at the ACC. We have an issue of people being in office but not knowing what their role is. What is the ACC going to do to resolve this? and that is from Milo in Overberg. So, Dean, you can respond.
Problem is that before I started the problem, I think I did indicate the issue of the staff shortage. It shouldn't be that when we go to a health facility, we have got uncaring people with a whole lot of the negative attitude. So that's why the best thing is about to make sure if there's an individual. However, the issue is not necessarily that we have to blame the individuals, it's the system on its own. And in South Africa, we don't have shortage of professionals. We've seen doctors protesting because they want to be employed, the nurses who have completed their community service, they need to be employed, but there's no money because the post is supposed to have money. And the Public Finance Management Act, you cannot appoint people and then you don't have money. We've seen in other provinces where, because of the political pressures, and then they'll say, we'll appoint you 300 doctors, only to find out over expenditures, and in other provinces, they've never paid them since January. So that's why the issue is the whole system that makes it a negative impact at the provincial level. National doesn't own hospital, they don't own patients, they don't own health facilities. It is the provinces that run those services with the money coming from the national. But with the budget shrinkages that we are having, and we've got a number of people using the health facilities, it puts a lot of pressure among our staff members. Where what we call moral injury, where they have to rock call and pay for it in regards to the triage, specifically in the health services, where we find that they have to start with the older persons. But ideally, there should be a fast tracking in terms of the older persons. I'm talking about vulnerable in terms of human rights, and also for those that are to the children. And then quickly on Krabok is the only center in the Western Cape that has got a 24-hour. It's only the hospital that's got 24-hour. Only Krabok. They've got EC, they've got emergency, they've got the maternity, which we provided to them, they've got the extended hours. And we've started phasing everything starting from where the referral system from Helderberg now to Caledon, they've been provided. But the issue is about the budgeting. They cannot have everything. There are people in other facilities, there are other facilities where we can say that they don't even have feet. Whereas Krabok, understandable the pressures, which is more or less similar with the deodorants, it is for them, they've got shoes. I mean, they've got feet, but although they don't have shoes. We try as much as we can.
Thank you very much, ICC.
Maybe to respond to the question, there are a lot of WhatsApps which I am interested to respond to as well, but there was a specific question directed to the ACC to say there are people in offices who do not seem to know what they are doing or they are unable to do the job. I mean, simply through the process, those people must be fired, and then you employ right people with the right skills, because that is very important. You cannot then occupy a post that you are not skilled for. Right people with the right skills must be employed. And that is what the government of ACC would do. There was a comment by a young lady there saying when they enter public facilities, they must be free, they must feel free. I can't agree more. Indeed, they must not be stigmatized, they must not be ridiculed. There are big issues with the professionalism in most health facilities. So the conduct of personnel leaves much to be desired. I think that comment comes from that background, and I agree with that lady. There needs to be something must be done with the management of health facilities and the conduct of personnel working in those facilities. They must know that they are serving the people, they are servants of the people. Thank you.
Thank you very much. So we're going to move on to the next question because we are running out of time. So Cape Town is known for the high rates of non-communicable diseases like diabetes and hypertension. How does your party plan to promote preventive healthcare measures and also encourage healthier lifestyles to combat these illnesses, and also taking into account the cost of living, because it's not always if you don't have an income to live a healthier lifestyle. So we'll start with Rise Mzansi.
Thank you very much. So this is why Rise Mzansi is promoting accessibility to primary healthcare facilities within 15 minutes drive. But also, I think, as has been said, that these are issues that need a whole society approach. Encouraging working with civil society organizations, education and health promotion. Encouraging, making sure that people have nutritious food that will help in terms of their health. So these are things that can be done. There are many things that can also be done outside of the borders of a clinic or a hospital. But that needs different governments coming together, different sectors of society coming together to make sure that we promote healthy lifestyles amongst all South Africans. Thank you.
Thank you very much. We're going to cut the time to 1 minute. DA?
Already we have a program that called WOW, WOW, which is Western Cape on Wellness, to be able to show people in terms of the preventive and promotive, people live a healthy lifestyle, even if they are not necessarily on treatment. In the issues related to the other communicable disease, because we mustn't forget mental health is part of that, as part of the quadruple burden of diseases in South Africa. We have to make sure that we do the budgeting accordingly. Unfortunately, in South Africa, whilst we have got the constitutional grants for communicable diseases like HIV and AIDS, there's nothing on the chronic diseases like the diabetes and other on mental health. So that's why it is crucial in terms of that at an input level, the whole of the South African health system needs to change. But lastly, we mustn't only forget the wellness part. That's why we are the first province that added Department of Health and Wellness to ensure the part of the lifestyle.
Thank you very much, DA. Good party.
Thank you. So preventative measures, yeah, that's a local government thing. So we know that we have at local government level, we have environmental health officers, and this is actually the work of the environmental health officers. So they need to go out and have workshops or educate whether the schools, NPOs, factories, workplaces. That is what we would do. Also senior clubs. You know, you have your senior people sitting at home, but you know they feel left out because what do they do? How do you incorporate them? And then also social workers at schools. I mean, there's sometimes you have children with the little issues, and you need to make this part of their well-being as well. And then food gardens. That is a big thing, especially in the Western Cape. If people start cultivating their own produce, they can eat healthier food stuff.
ACC?
Thank you very much. There are community-based organizations already in almost in all communities. What is needed here is partnerships. Government partnering with those communities who are working in the welfare environment, working together in order to make sure that people live healthier lifestyles. Gyms, exercise gym facilities in the areas where people live. But people must also be made to understand, be educated on the goal, and it must be coupled with some sort of a reward system, especially for those who never really partook to these things. But as I said, the bottom line is to partner with community-based organizations that are already active in our communities instead of reinventing them. Thanks.
EMC?
Yeah, in terms of